Welcome back. I'm going to share a few points related to a day in the life of a medical coder. For those of you who do not know what a medical coder does, what the work relates to, the roles and responsibilities, this small chart here, can call it a process workflow chart. It explains to you the different functions. So, point number one, we're talking about healthcare industry. We're also talking about if the medical coder is working in a clinic setup or in a hospital or even on the payer side. Okay, what is their role? Yeah. Now, if you see the chart, it says revenue cycle management, RCM is the other word. It's called RCM. And when a patient goes to the hospital or needs to go to the hospital, they need to take an appointment first. So the patient registration function or the department or the process needs to be carried out where the patient needs to get an appointment. The patient demographics are entered into the system. The insurance eligibility verification is carried out. Authentication or authorizations are taken, and if they are referred by any let's say any physician or healthcare professional to a particular service provider, all that information is keyed in from the hospital side. So the entry level is the patient registration process. Now once the patient registration process is over and the patient has an insurance eligibility, or rather a verified insurance or a valid insurance, the patient gets a time or an encounter with the healthcare professional that they are seeking the appointment for. Okay. Now, after the patient meets the healthcare professional or the doctor or has an encounter, the doctor writes down, or the healthcare professional writes down the patient case sheet or the medical health record, right? So writes down what are the condition or what is the condition of the patient, carries out certain tests, yeah, so let's say x-rays and MRIs or blood tests, or the patient goes to certain procedures to come to a conclusion for a diagnosis and a condition, and then followed by what kind of treatment the patient should be given. So, all of this information is recorded by the healthcare professional in a medical health record, right? So, this medical health record goes to a medical coder. Okay. Now, in some hospitals or in some healthcare centers, there is a process or a step in between where the patient case sheet is then typed into or fed into the computer. In some cases it's written first and then made electronically. In some cases it's directly fed in. Okay, it depends. Now with this patient case sheet or this medical record of the patient, the coder is the first person who will get this information or this input to go through the patient case sheet, to go through the prognosis, the diagnosis, the treatment, and the procedures, and then assign the codes. Okay, so why does the coder need to assign the codes? The coder will need to assign the codes for the simple reason that the healthcare professional needs to be paid for the services that they have offered to the patient. Or, let me put it this way, the services rendered to the patient needs to be paid to the healthcare industry or to the, let's say, hospital or the clinic. Okay, so basically, it's about being paid for the services that the patient receives or the hospital or the doctor gives to the patient. So, when the recorder assigns the codes that are relevant to the patient case sheet accurately, those codes which are entered in the system are then sent to the billing department. Okay, so you'll see other functions here in the claims management. It comes under coding, then you have the charges posted, then you have claims scrubbing, process and transmission, and payment posting. So we're not going to touch upon what all those functions are because they are all different departments. We are just going to focus on what a coder does. So now the coder has already keyed in all the relevant codes, assigned the codes, and sent to the billing department. The billing department or the medical biller then adds the value for the bill or adds the value for the services that has been rendered. Okay, so they'll have, each hospital has its own, chart, or has its own rate sheet for the charges for the services offered. So the biller will be able to put the bill or select the right charges according to the codes that have been assigned. Yeah, and then the patient case sheet is, or the bill has been arrived upon and then sent to the medical insurance company, and the insurance company verifies it and then pays the money to the hospital. So this is the process. You can see AR management where there is follow up, sometimes there is denial on the claims, and and so on. Then there is a patient collection process or a department, and you have the analytics department. You also have the credentialing and the contracting functions. So we are not going to deep dive too much into this, but we are focusing on the medical coder's role. So if the medical coder is not able to assign the codes accurately, what happens? Then the healthcare professional or the clinic or the service provider is not going to get paid accurately for whatever service is given. Hence, we can term it as time equals money. The time of the healthcare professional equals money. So, needs to be changed to money, to payment, right? So we try to put it in a very very simple manner that you can understand. It's not about using all those fancy jargons. It's about making a person understand who does not know anything about coding, anything about healthcare industry, but heard that there is a profile or a role as a coder and interested to learn medical coding. So once you learn coding and do your CPC, what beyond that? So you also need to know what kind of industry you're working in, what your role involves in. So basically per day you'll be reviewing a number of charts. You may have targets, you may have 100 charts, you may have 200 charts, not sure, depending on which process and which specialty you're going to code. So you have to consider the specialty you're coding, right? And also, you will consider high levels of accuracy in coding, which means you should use your skills eye for detail. Okay, so having said that, I hope you understand that what a coder does: reads the patient case sheet, assign the codes accurately, and submits it to the billing department when the biller takes over from there. So this whole revenue cycle management process is to generate the revenue for the hospital or the healthcare center that the coder works for. So we would say the coder is a golden link in the chain, in this whole chain. Okay, everybody's role and responsibilities are important. Everybody has a unique role to play, but we say that the coder is a golden link because you link the patient services, okay, the medical health record chart, to the billing department by assigning the accurate code, hence converting the time of the healthcare professional into money. Okay, I hope I'm clear. Okay, so this chart is the best way that we could represent the role of a coder, and that it's called, the whole process is called revenue cycle management. Thank you, and I hope it was useful.